Hello, everyone, and good evening from London. And thank you so much for allowing me to speak on World Health Day, which should be a celebration of all the amazing things that have been happening in the last few years in the world of healthcare. Although the COVID pandemic has been difficult for all of us to manage, at the same time, it's given us an opportunity to rethink, reimagine the model of healthcare around the world. We've seen the inequalities that have come to surface during the pandemic, the gross inequalities of healthcare around the world. And actually, what we can do going forward is make healthcare more affordable, more accessible, and more equitable. So I think that's the premise of my discussion around what I've been doing personally, and also taking a look into that future. The first thing to think about is that we have these amazing exponential technologies that are coming at the same point of human existence to let us rethink the model of health and care. Whether indeed it's things like cloud computing or quantum computing or AI, deep machine learning, immersive tech like virtual reality, augmented reality, connectivity with 5G networks, bringing more people around the world who are connected, holograms, avatars, nanobiotech, genomics. 10 years ago, we didn't have this language of innovation. We're now seeing that all of these technologies are converging together to allow us to reshape what we think the health and care of the world should be and could be, quite frankly. So it's about convergence, it's about collaboration, working together with different stakeholders, patients, healthcare workers alike, to think about this new model that we're working with. The pandemic has been difficult, but also it's given us the advantage of fast innovation, translation to clinical practice, less rules and regulation, less bureaucracy for a change. So it really allowed us, some of us who are innovators and the early adopters, to rethink and reimagine. But what about the globe as a whole? We know there are certain pressures we've seen already, the enormous strain on healthcare at the moment in terms of a workforce who are at breaking point, who are leaving the profession in their droves. If we go back to an article or a document from the World Health Organization back in 2015, it showed that by 2030, we'd be about 14 million health workers short around the world, and maybe more in the current context. So how do we train more people? How do we create smarter work to deliver the kind of the healthcare that's required across the world? Of course, during the pandemic, we also saw the inequalities of surgery as my own profession. Here we are, this image taken from the Lancet and also the British Journal of Surgery. On the one hand, the Lancet Commission 2015 showed the gross inequalities of surgery. It was estimated that 5 billion people around the world do not have access to safe and affordable surgery, with common operations not being performed well enough, with huge morbidity and mortality associated with it. The British Journal of Surgery reported that the surgical operations carried out during the pandemic, in the first part of the pandemic, they showed that a lot of patients were cancelled from having their surgery, which might be life-threatening, cancer treatment, or indeed elective surgery for, say, for orthopedics, for example, allowing more morbidity to develop. So that was the context of the world that we live in. In the UK, for example, where at least 6 million people are now waiting for elective surgical operations. We've got to figure out how do we overcome that by using new models of elective surgery. I think how do we use a smarter workforce to create that? We're also being helped by a digital transformation. WHO, in their own guidelines a few years ago, recommended that digital interventions would strengthen health systems. And they recommended a number of interventions, and there'll be more to come, WHO. Of course, we're governed by the UN and the Sustainable Development Goals around Development Goal 3, around healthcare. And again, thinking about how do we bring that healthcare forward to make it much more fairer. And is digital transformation part of the solution? And I probably think it is. In the UK, we're also helped by articles and reports from stakeholders, from the government, from the NHS, so that we've got to do better. We've got to prepare a workforce of tomorrow from the Topol Review, from Eric Topol, who of course is a keen enthusiast on digital health and innovation. And also our own Royal College of Surgeons and Department of Health pushing forward boundaries of what's achievable. And putting money and resource behind this. The first thing is, how do we create that digital doctor of tomorrow, or the digital nurse for tomorrow? And I think what we've seen now is how we re-establish curriculum to bring innovation into the heart of the curriculum. Also about bringing digital technologies and health, supporting entrepreneurs around new ideas and new ways of thinking, and even being creative in their understanding of what's possible. And it is the art of possible. If we look at the patient experience as being the fulcrum of innovation in healthcare, we know that we're moving towards a more preventative and lifestyle changes, preventing illness, maintaining good health and well-being. It's been a buzzword during the pandemic. We've seen telemedicine, telehealth, create something called total triage. So you can now do remote monitoring, remote patient work. Or what about the chronic disease? Huge burden, diabetics, COPD, patients form the vast bulk of the work that we do in clinical practice. In fact, in the UK, the NHS spends 2/3 of its budget managing patients with a chronic disease. What if we make healthcare more personalised and allow people to be monitored remotely, as we've seen during the pandemic? So these are the kind of the 5 pillars now of improving that experience of patients so that they are more compliant and also actually going to be much more supportive of change in the healthcare system. The patients are our partners. Let's not forget that. How do we engage them better to ensure that their own experience is improved? We've seen the rise and rise and rise of telemedicine. We've seen some clinics and some hospitals increase the usage of telemedicine by 5,000 to 8,000% during the pandemic. That's come down to a steady state, because people now want a mixture of face-to-face and telephone and remote telemedicine care. We've seen an explosion of companies out there offering 24-hour care. And we've seen the patients take it up also. Say, actually, we're happy for some patients to be managed in this way. And so we're now kind of rebalancing the kind of uses of face-to-face versus tele and total care. If you take that one step further, this is Ping An, insurance company in China, who are now, this was I think a couple of years ago, even before the pandemic, they have 300 million active users on the telemedicine platform, insurance-based system. Imagine that telemedicine around the world, scaling up very quickly around utilization. We've seen that, of course, during the pandemic. What about if you actually take away primary care entirely, and actually face-to-face becomes a kind of a kiosk? We're seeing now some of these developing in some countries. We can now see a doctor or see a healthcare professional in a booth with your smart card. You could go next door, and the prescription for medication, you can use your smart card, and outcome medicine, and you walk away. Maybe take away the bricks and mortar for healthcare, put these remote areas to allow people to connect to doctors and healthcare workers to manage more remotely. Maybe this is a model that we need to think about, reducing the costs of healthcare. This is my own clinic now. It's changed enormously. I sit in my clinic at home sometimes with my laptop connected to the electronic health record, and also, of course, the telemedicine platform on an iPad. I've changed. I've become more remote, working independently. And patients themselves are also more independent. Healthcare now is coming to them. They're now in charge at their own convenience, at their own time, not taking days off work to go and see a doctor, for example. So it's much more better and much more convenient for people. And I go around the wards now remotely with a beam telepresence system, doing my ward rounds. And now that's acceptable because people want remote care and are happy for you to see and engage with patients from different settings. So remote care is coming in big time. We talked about chronic disease earlier, how we manage that differently. And you know, patients with diabetes and COPD and others are a huge burden to the healthcare system. But can we now persuade them to think about being managed in different ways, whether it's real-time glucose monitoring using either sensors like this Freestyle Libre and others, or a Tesla suit, smart jacket, measuring the variables, or ECG monitor through the Alive Core, or a smartphone. And maybe we can go to the artificial pancreas, manage people remotely using technology. So we're now seeing patients moved out into the community. It is about driving care into that community rather than keeping secondary care. How do we connect social care, primary care, and secondary care that's much fairer? And the balance of resources is placed in favor of well-being and remote care, as well as prevention and lifestyle changes. AI has been very interesting, of course, the last few years, promising much. I've talked about AI as the hype, the hope, and the reality. An enormous hype about what it could achieve, the hope that it could change all of our lives and improve and move us on. Now we're seeing 2022, the reality of what actually the use cases are, and how AI and deep machine learning can be used, whether it's diagnostics or patient monitoring or indeed treatment pathways. We've seen, of course, AI, a number of areas that now are important and developing as we speak. There's diagnostics, drug discovery. We've seen that, of course, in the pandemic with the acceleration of the vaccine for COVID, as well as the chatbots and the conversation engines, and of course, AI surgery. We're seeing different companies, different areas, whether it's using natural language inputs, patient data, or operational data from providers, looking at early detection, diagnostics, treatment management, and of course, monitoring outcome. Many companies out there now working on these portfolio of work using AI. We've seen it being used in retinal scans, OCT scans to predict retinopathy, for X-rays, images, CTs, predicting outcomes, and also looking at dermatology and of course pathology, all the things that allow image translation acquisition to be able to diagnose certain problems. We're seeing a plethora of these being used. In the UK, the NHS used the images database and let everyone have a go at using them to create models that would predict the outcome of COVID. Nice way of working together, allowing images to be used open sourced for companies to work in. It's that collaboration. So of course, chatbots come in, conversation engines, and this will be the first point of contact in the future. Simple exercise, asking question, response, and understanding where a simple diagnosis might be. Also allows triage, allowing patients to be seen, that need to be seen appropriately. Those that can manage remotely can be managed remotely. So I think it's a way of managing the burden of healthcare at the primary source of contact. We've seen biomarkers come in, predicting disease just by your voice, by your tone, your talking, working out exactly what the problem might be. This is a company called Beyond Verbal who could predict cardiac disease about 4 weeks before it arose, purely listening to your voice. So actually it prevented hospitalization, and of course it manages well-being and healthcare in the community. We've seen messaging coming in, connection, communication with telephones and smartphones. Actually, we're seeing a number of these companies now using like a WhatsApp messaging that's more compliant, has more governance around it, more safe and secure. Now we're seeing that being used rather than the old bleep system or the archaic system we've used before. Real-time analysis, real-time saving of time for people, and to manage patients better using real-time communication tools. We've seen external reality coming in, AR, VR, mixed reality. What are they? Where AR is one end of the spectrum, is augmented reality. We can see a pair of glasses and see through the glasses in the real world. VR is the opposite. We can't see the outside world. And mixed reality is in the middle somewhere. And now we're seeing the holograms avatars being developed in terms of what's called the metaverse. And the whole thing combined is called extended reality, or XR. If you go back a few years, I was thinking about education, how we improve it. This is me wearing the Google Glass in 2014, 8 years ago. I streamed a live operation, a cancer surgery here, as you can see in the picture, around the world. I trained 14,000 students across the world using just a simple headset, smart glass, which would stream live, and I could communicate with people remotely. Again, showing the power of connectivity and simple technology to allow this to happen. We've seen a plethora of smart glasses now taking off, and soon we'll see many more coming out that will be of much more form factor, they're much more sleeker, like normal glasses, and so it won't be as difficult to manage as the Google Glass, which has some negative press, of course, at the time. We're seeing remote care, it's proximity come from the UK. What they're doing is doing remote care, training remotely. And what they're doing with their platform is using it to stream live, support people remotely, and train people and support people in remote areas. What about virtual reality? We're seeing a real interest now in VR because of remote training being more predominant recently. And it's been a journey for the device companies. Now we're seeing much more smaller, more sleeker devices that allow you to have 60 degrees of freedom, motion tracking, eye tracking, untethered. Oculus Quest 2, of course, is the one to go for at the moment, as well as the Pico and the HTC Vive Pro. All are standalone devices, very powerful and relatively cheap for what they can do. We're seeing our training develop in those ways. We're seeing VR medicine, VR therapy, whether it's for stress disorders, anxieties, phobias, for pain relief, even replacing epidurals, augmenting epidurals for labor. Patients, women who are having children or babies can actually ask for VR therapy. And we're seeing reduction in allergy requirements. We're seeing many patients now undergoing clinical trials in that sense. In the UK, we're seeing patients with long COVID have rehabilitation remotely using VR therapy. Really, again, remote care, managing with technology. But of course, it does have an advantage. This is PwC's own work, which shows that people who use VR require less time to learn. They are faster learners. They are more connected to the learning. They're more focused and more confident, showing actually the value of this new way of educating people. Mixed reality is another element, of course. There's two devices, the Magic Leap, and Magic Leap 2 is going to come out fairly soon, and the HoloLens 2 as we speak on the left-hand side. These allow amazing, powerful captures of images and videos within a smart glass, if you like. We're also looking at this avatars, holograms being developed. This is my own avatar created on HoloLens 2. This was me collaborating with surgeons from around the world in what's called the metaverse. We want to be transported, of course, like the Captain Kirk in Star Trek. And actually, if you think about where we are now, we're now more remote. We're working from home. Actually, do we need to travel as much? Can we be more remote? Can we work remotely? And working from home has been great for all of us. Better quality of life, better healthcare. And so I think that's the way we need to go forward. My own world of surgery has become digital, and the concept of digital surgery has now become more pronounced. And these are the 5 pillars in my mind: robotics, enhanced visualization, advanced instrumentation, connectivity, and improvement of outcomes using data analytics and deep machine learning. It's about big data. Surgery now is going to that same direction with reducing variation, improving outcomes, and data is the basis of all of that. We've seen robots come in. We saw the world's first remote surgery happening about in 2019. So a robot working remotely was operating, and surgeon was remote to that, connected with 5G, which has got obviously very high bandwidth and low latency. Another connection between the kind of the doctor and this machine now, this picture you've seen many times of course, is that interaction become more and more automated for us. We are seeing, of course, the brain-computer interface. We've seen now patients, for example, with neurodegenerative disease or neurological problems, think about how they can now be connected and supported through a Neuralink or a kind of BCI, brain-computer interface. Could that be a way of managing people's emotions or indeed motor function? We've seen now people with kind of robotic arms who've had amputations before, for example, in this case. Now you can move them with your mind, your muscles, your nerves. So it becomes actually replacing a kind of the human touch, but also allowing you to have function. So that's a real promise for a lot of people who may need to have this. What about patients with eye disease who can't see? Could that be changed with a brain-computer interface? We don't know. We'll see what happens as we go on. We're also seeing digital humans come in. We're seeing people now become more and more remote, but also more lifelike. This is an example of a digital human being created. They're lifelike.
Hi, I'm Roman, a digital human brought to life by soul machines. With me, you can experience AI like never before because I learn and react emotionally like humans do.
So we're seeing this whole concept of digital twins, digital humans, avatars, holograms, not replacing us, augmenting our existence, supporting doctors and healthcare workers, making lives easier, automating some of the work that we can't do. And that's the way we create smarter workforce that's fit for the 22nd century. What about this journey to Mars? We're going to be soon an extraplanetary species, according to various people who are interested in promoting Mars, like Elon Musk and others, and Jeff Bezos and others, creating this kind of race to get to Mars and off the Earth. The aims are impressive, but what that teaches about remote care or or traveling remotely is what does care look like here on Earth? And that drives change almost for all of us. We've seen the advent of 3D printing. 3D printing has promised much before in terms of what it could be used for. It's been disappointing at the outset. What has happened, of course, is the printers have become cheaper and more affordable. now they are really quite cost effective. We're seeing now them being used even outer space. So here is a printing machine sent to space to create splints and other devices for the people down on the space station who might have injuries, for example. So we've seen how this pushing remote care in space is relevant here. We can now 3D print instruments, for example, neural communities, 3D printing bones, for example, so that we can now support people in terms of surgical appliances. So thinking about pushing that boundary to space, and how does it work for us here on a global level? And it's about being rural, isn't it? Rural communities, communities not connected, communities that are hard to reach and are poor by definition. How do we elevate, let them leapfrog society using some of these technologies in that way? We've seen now the advent of 3D printed organs at a very early stage, bioengineering, whether it's a kidney or a heart. We're seeing the early kind of signs that in the future might be able to reproduce some of the organs, support aging, support the lack of organ donation around the world. Maybe this is a way of pushing that forward over the next 5, 10, 15, 20 years. I've shown you a very glimpse of that future. What I'd like to leave you with this whole conversation is the future is already here. It's just not evenly distributed. It's a quote by William Gibson. I think this whole conference today, World Health Day, is going to really for us to reimagine what could be possible. There are examples out there already around the world. We've seen countries do amazing work with the pandemic. We've seen technologies around the world improving outcomes. We've seen patients engaged in a way that we've never seen before to allow us to rethink that model. So I think it's about collaboration. It's about convergence. And ultimately, it's about care. And that care now is going to change for all of us. And it's up to all of us individually to rethink that model and to ensure that we have a healthcare that is affordable, that is equitable, and that's affordable. Thank you so much.